Dr. Konstantinos Margetis is Assistant Professor of Neurosurgery at the Mount Sinai Department of Neurosurgery in the Icahn School of Medicine. He did the majority of his medical training in his home country of Greece, receiving his medical degree from the Aristotle University of Thessaloniki Medical School and his PhD from the University of Athens. He completed neurosurgery residencies at Evangelismos Hospital and the General Military Hospital of Athens. After coming to the US, he completed a fellowship in pediatric neurosurgery at Weill Cornell and a fellowship in spinal surgery at the Cleveland Clinic. Dr. Margetis and his wife, Stella, live in New York City and have an 8-year-old son, Dimitrios, and a 2-year-old daughter, Maria.
What is your usual role within Mount Sinai? What have you been assigned to do during the COVID-19 crisis?
I'm the Chief of Mount Sinai Morningside Neurosurgery, and now during the COVID-19 crisis, our roles have been modified to try and help with the COVID situation. So right now, we're not doing elective surgeries, and personally, I have been involved with the surgical intensive care unit at Mount Sinai Morningside, and I'm assisting them in handling the significantly increased caseload of COVID patients that we have at Morningside.
Can you describe what your new day-to-day life is like? How many days and hours are you working each week?
We come in the morning and first we round on the neurosurgery patients because we still have an active service at Morningside. And after we're done with checking on our own patients, then I go to the intensive care unit and I'm assisting the intensivists over there. And I'm also actively being trained by them in order to be able to handle the patients independently should the need for that emerge.
What sort of new skills have you had to acquire to do your new responsibilities?
Yeah, it's about managing the COVID patients in the critical care unit. As neurosurgeons, we have experience with critical care patients under normal circumstances. Many of our patients are in the ICU, especially in a trauma center like Morningside. We have many patients in the critical care unit. So we do have experience, but we don't have experience, with the COVID patient. Actually, nobody had before that. But due to the circumstances, we were developing the skills to manage these patients to the highest level we can. Also, we have the infectious diseases actively involved in all the patients to guide us with the specific medications that these patients need. And also the critical care physicians, they handle the ventilator because these patients, they need complex management of their respiratory system that it's not a skill that you can acquire that easily. It requires many years of training, and even in an emergency situation like that, it's difficult to develop these skills. So our role is to help with the management of the other systems of these patients and provide assistance to our colleagues at an attending level, at a higher level. So for example, we might have to do communication with the families, we might have to guide our teams on how to handle the problems from the other systems so that our intensivists and our infectious diseases experts, they are focused on the most complex of the problems that these patients have, and this is the respiratory system.
Tell me what it's like in your unit now.
I mean, we're definitely very careful with the personal protective equipment, how we put it on, how we take it off, because there's a special technique. It's actually very easy to get contaminated, especially when you're taking it off, because the outside, what you're wearing, most of the times gets contaminated. So you have to be careful on how you handle the mask, the gown, how you remove it to make sure that you don't get contaminated. And it's not only about our personal health, it's also about preventing the spread of the virus to other people around us, other colleagues or other patients.
How has your role in the Department of Neurosurgery prepared you for this new responsibility?
I definitely believe that neurosurgery has helped us adapt to the new situation with less difficulty. I wouldn't say easily because it's not an easy situation, but with less difficulty. And it has helped us in multiple ways. The most important way is that we already have experience with critical care patients, and we feel comfortable working in an ICU environment. is not something new for us. The second thing is that in neurosurgery, very often we have to deal with very challenging cases where our decisions can make the difference between life or death, and very, very stressful situations. So it's not something new for us to be exposed in a very, very stressful situation. It's something that I believe all neurosurgeons are kind of used to it.
The coronavirus is scary. Everyone has a certain level of fear about what might happen to them if they get sick. How are you feeling? How have these feelings influenced your work?
There's definitely a degree of nervousness, but the degree that motivates you to be super careful with what you're doing. So I think right now, this degree of nervousness is productive. It helps us, be more careful. It's not something that it will affect us in a negative way. And the morale definitely stays very high, and that's very, very good to see, among our co-workers, among our colleagues, that everybody has a high morale, and everybody understands how critical their role is right now to save the lives of these patients. Many people who work, around us have gotten sick. Unfortunately, there were a couple of people who didn't make it, so there is a degree of nervousness, but we remain hopeful, and we believe that we will get over that situation soon. It will be back to normal. There are many little things that they really impress me on how people handle the situation. They handle very, very effectively. When all that started, I was afraid that we'll have to take many measures to boost the morale of our co-workers, or of people who work in the hospital. But I was pleasantly surprised to see that there was absolutely no need for that. Everybody was there, willing to help to the best of their abilities to handle this, extraordinary situation.
What has impacted you the most emotionally?
Yeah, definitely. The loss of some patients, and the loss of some co-workers. Yeah, that's definitely.
Are you doing anything outside of work to help you power through this? How about sleep, exercise, reading, meditation, cooking, touching base with your family and friends? What are you doing at home to help you make it through the day?
So actually, I'm trying to get more sleep. I believe that this helps the immune system. So I'm trying to keep my immune system in top condition, and I think that sleep helps with that, or at least that's what's happening with me. So I'm trying to get some extra sleep whenever I have the chance.
I'd like to know how you're handling your personal life with your loved ones during this crisis. Are you living separately from your family? Is your family living separately from you?
In my apartment, we have two separate doors, and we're able to isolate a part of the apartment, and this is where I'm living. So although I'm still living in my apartment, but I'm separated and isolated from the rest of the family. So that's the measure we took to prevent any spread of the virus to the family in case I'm an asymptomatic carrier. It has actually been more difficult than I was expecting it to be. Although, I hear them, I can hear them, through the door. I can see them through FaceTime. But I realized that, being able to touch, your kids, is more important than we thought it was. There's no, let's say, a replacement for that sense of being able to hug and touch your kids. Yeah.
What would you like other people to know about what you are experiencing and what we are experiencing taking care of this crisis?
I believe all of us, all healthcare workers, we're doing really our best to manage the situation. And I have been really, amazed by the response of all my co-workers to their response to this situation. But, this is half of the battle. The other half of the battle is out in the community on, the measures that everybody needs to take to prevent the spread of the virus in the community.
Do you think your life will change in long-term ways because of this crisis? How do you think healthcare is going to change?
That's a very good question. Yeah, I think that there will be changes. Probably telehealth applications will be more prevalent in the future. But I also believe that people will be much more cautious in taking measures to prevent the spread of communicable diseases. Probably there will be a new market for things that we right now we have to touch objects to get something done. Probably there will be new solutions that don't involve any kind of physical touching of objects. So I think there will be many changes in the future, as I said, both in the healthcare delivery, but probably even more importantly to prevent the spreading of these diseases. It's almost certain that the virus will be around, so we'll have to maintain a level of caution and a level of prevention measures. It remains to be seen how strict these measures need to be, but I don't think that there will be a day that will be done 100% with this virus. I think that it will continue to give us trouble for some time.
When the worst part of this crisis is over, what's one of the first things you want to do?
I believe it will be to hug my kids,